You're listening to the New Dominion podcast, where we engage in faith-filled and curious conversations about stewarding your health and community with others. I'm Dr. Abbe Keen, chiropractic physician here in St. Louis and functional nutritionist. And I'm here today with my husband, Taylor Keen, mental health counselor, and our other co-host, Kiersten Hansen, who has been introducing the podcast thus far. But today we're going to change things up a little bit, and she's kind of a special guest. So welcome, Kiersten, and thanks for being our special guest.
I didn't know it was going to be changed. My name was going to be changed to special guest.
I know. Well, she's a functional nutritionist with a whole host of other qualifications, which makes her so incredible to be a part of this podcast and to help us have these hard conversations. But she has a health story of her own that I think a lot of our listeners will relate to. And I think it's a story that is becoming more and more common as our health in the United States shifts. And I think everyone I talk to is somewhat aware of it. And so I just thought it would be really great today if Kiersten just started by telling us your story, what you're comfortable with sharing of just, I mean, really it's a story of how you got here and how we got to know each other and eventually become friends. But it also is a lot about your health journey. So I'm just going to open up the floor to you and let you share. And then we'll just springboard our conversation off of that.
We'll ask you lots of in-depth questions that you don't have to answer. That you don't have to answer.
Right.
I've never had someone just feel like, all right, tell your story.
I feel like I did that when you first became a client at Crossroads back in 2017. So
you told me to tell my story.
Usually I'm like, tell me your health story. I like to hear it. Even though everybody fills out all that paperwork, I just use that as a guideline. And I just because I think when we tell our stories, it's different than when we fill out paperwork, right? When you sit here and I can look at your health history and see significant things, right? Surgeries, medications, relationship things that I think are important. But when you allow the patient in the seat to tell you the health story, after they've filled out the paperwork, after they've been kind of ruminating on why they're showing up in my office, what they tell me is different. It's just different. And what they highlight is what's important to them, usually. And even though I might see that they're dealing with high blood pressure, what I might be hearing in their story is the stress of their job or the hardship of losing a child.
Yeah.
And that is really much more important than just being like, all right, stop drinking soda to get that blood pressure down, right? Like that's very impersonal care. And as we've alluded to in all of our other podcasts thus far, interpersonal relationship is really important for healing. And so,
I usually tell people to start with, wherever you want when you tell your story. And so they look at me confused because now the spotlight's on them. Like, what should I say? And I'm like, you can start with conception. You can start with today. You can start with why you made the appointment. You can start with any place in between. Because the truth is, in counseling anyway, maybe not in this podcast episode, that we're going to get to all of it at some point. Like the highlights, the important things are going to come to the surface. And the important things today might not be the important things that you would share when you first started meeting with Abby or whatever. But that means for our purposes today, what is the most important things about your story that you feel have shaped your health journey?
Yeah. So the overarching goal of this podcast episode is to talk about the difference between mechanistic and vitalistic care. And
can you define that right now? Because for us people.
Oh yeah, I didn't even say. I was so thrown off by doing the intro. I forgot to even say what the title of the episode was.
So even now, Kiersten, as our special guest, is still piloting the episode. So
great job, Kiersten. Way to be true to who you are. Yeah. So today's episode is called You're Not a Real Doctor. And again, I just love these titles that kind of are a little bit provocative because I've heard that a lot. Our practice is often serving those who have gone to multiple doctors and have had no help, whether it's for systemic chronic issues Or maybe it's a mom whose first pregnancy, she was hoping for birth to look one way and it looked completely different. And she heard chiropractic might help with the outcomes. So they come hoping for something different the second time around. And that's really who we serve and why we exist a lot of the times. And even in those conversations, I will have patients come and say, well, my real doctor says this. And they don't mean it in a way that is condescending, I don't think. I don't take it that
You
way.
don't think?
I mean, they're sitting here, so there's some level of respect there. But the space of, yeah, it's just a different type of training and perspective and paradigm. And that's what we've been talking about on the podcast so far is our paradigm, where we're coming from when we look at healing and health. And early on in chiropractic school, I learned two words, vitalism and mechanistic. And mechanistic care is what we've really grown into in our Western, we call it allopathic medicine, what most people are used to, MDs, pediatricians, very just United States medical system. And that is having specialists and people who focus on one part of the body. So if someone's having kidney pain, and bladder issues, you're going to go see the urologist. Your primary care is going to refer you to someone who takes care of that part of the body. You're having chronic ear issues, you're going to go see an ENT and you'll get sent over there. So that's a mechanism. It looks at the body as a machine. Thus, where mechanism comes from. And you're looking at different parts, but not always the whole, which again, we had that conversation about WHOLE. Vitalistic, let me add one more thing. Mechanistic also seems to come at things as a problem to solve. Now, I'm not a trained MD. I'm a trained chiropractic physician, so we have different paradigm. So I might be misspeaking, but typically MDs are looking at what's the problem that I'm solving. And that's why we have things like medications, like, oh, you're in pain, take this pain reliever. Oh, you're having heart palpitations. This drug changes your heart physiology so that those palpitations stop. And I'm not against medications. They can be extremely helpful in many situations. However, at some point, there becomes a place where you miss the whole person in light of all those little problems. And I'm air quoting for those of you who are just listening. Vitalistic care, vitalism, is more of a paradigm that recognizes that you are a whole person and that everything is connected to everything else. Personally, because of my belief in Jesus and believing that what the Bible says is true, I really truly believe that our bodies are a good design, that God made our bodies fearfully and wonderfully made, right? As it says in the Psalms, and that our design is perfect. Now, are we in the fall? Adam and Eve, there's sin, there's brokenness, there's consequences to choices that we make. So our bodies are not supernatural and going to be able to last forever. But there is a space of goodness in them. And so when someone comes in complaining of a health symptom, I'm not afraid of the symptom or concerned of like, oh no, what's this problem? I'm looking at it as, oh, that's interesting. Why would you have what is your body trying to tell you about this symptom? And how do we support your physiology that will naturally self-correct? We've talked about homeostasis. We've talked about hormesis on this podcast already, about how your body is always trying to go back into balance. If you cut your finger and you're bleeding and you put a Band-Aid on it, the Band-Aid does not heal you. Your body heals that cut on its own through its own immune response, white blood cells, the inflammatory cascade, all these things. The Band-Aid is just making sure you're not bleeding all over everybody. It is not the healing thing, right? And so coming out of that mindset of like the body knows how to heal itself, but how do we give it the environment that might be lifestyle choices, the energy that might come through food or supplements for a while, and the hope, the relational aspect, having people around you that are going to cheer you on is really what vitalistic care looks like. And that's what we're going to talk about today.
Thank you for defining those things, because those words are not words that enter the counseling paradigm very often, or ever. I would probably say ever. And so, yeah, like with that, Kiersten, I'm curious where you would start with your story, coming from this journey from mechanistic to vitalistic. How does that go for you?
Yeah. So I started experiencing a lot of pain, like physical and emotional pain in 8th or 9th grade. And the physical pain manifested itself in like just a lot of back pain, a lot of tension in my upper back, neck pain, joint pain in my arms and hands. My arms and hands would be tingly and numb sometimes. And I started telling my parents this. At the same time, I started feeling what I could say and name at that point as some depression and anxiety. I don't know that I shared that with my parents or anyone initially, but I could talk about the physical pain. And after my parents tried everything that they knew to do, getting me different backpacks, or my dad, they would like massage my shoulders. But I do remember my dad like giving me hugs and trying to crack my back. Saying quotes.
Common.
And that would actually provide a little bit of relief for a minute. And so after trying things for a couple of years, probably, and the pain not going away, I saw several different doctors, got a referral for physical therapy, did some of that, had MRIs done, MRAs, nerve conduction studies, CT scans, lots of blood work. And looking back now, I'm like, they probably thought I had cancer or something like that. It was just, nobody could find what was going on. And so they just kept running more tests. And really, I don't even know. I guess actually during that time, I didn't even think to talk about this earlier, but I also had recurring sinus infections and took like multiple rounds of antibiotics every year. So that's the only medication that I remember taking in high school, like taking a Z-Pak for sinus infection, getting steroid shots, but the pain continued. My freshman year of college, I had a doctor who I think tried to look a little bit more at the whole picture. And when I told her that I also had felt depressed and anxious, she prescribed me Cymbalta, which is it's an antidepressant that also has an element to it that blocks your neurotransmitters from sending signals to your brain, signals of pain to your brain. And so that provided a little bit of relief. She also prescribed me muscle relaxers. The muscle relaxers I hated because I would take them and then the pain would wear off momentarily. And as soon as the muscle relaxer wore off, which I could only take at night because I needed to drive and do life during the day, I would wake up in the morning and the pain would be right back where it was before I had taken the muscle relaxer. So at some point in there, I mean, I took Cymbalta for several years, and at some point it didn't solve the pain. And I remember having, probably towards the end of college, going on a couple of different long trips, like traveling internationally and then going on a long road trip and coming back from those trips and my hips really hurting for the first time. And I think before that, all of the pain had been upper back, neck, arms and hands. And when my hips started hurting, I could stand okay and I could lay down okay. Sitting down was really uncomfortable, and laying down really wasn't. Sometimes that was even uncomfortable. Standing was the most comfortable position. And I remember going for a walk in that season and being like, Lord, if this is how if my pain is going to be this high for the rest of my life, I do not want to keep doing this. Like the pain was just, it was so constant and inhibiting so much of my life. And around that time, we had someone we knew from my church started talking to me about different autoimmune possibilities, which I had had a lot of blood work done. So a lot of what she was talking about was guessing, but she did recommend that I see a chiropractor. Before this point, my grandmother had seen a chiropractor, and my grandmother would recommend it and for me. And my parents laughed off the possibility of a chiropractic care because they called chiropractors witch doctors.
A very Southern thing to do.
Very Southern thing to do.
Well, they're not real doctors, Kiersten.
I mean, my dad still says that sometimes. So.
Gotta love it.
Now, when I hear that, when you were explaining the difference between mechanistic and vitalistic earlier, I was thinking, when people say to me that a chiropractor is not a real doctor, it makes me mad. So I saw when this person from our church suggested that I see a chiropractor, I started seeing a chiropractor and saw him multiple times a week for a couple of years. And I used to live in Memphis. So this was all in Memphis. And I remember experiencing, like, that was the first thing. He gave me some stretches to do. He also recommended that I ice my back every night. So I'd like lay on ice packs for 20, like until I couldn't feel the pain anymore. And then I would go to bed. But the things that he suggested did provide some relief. And that was the first time I think that somebody had suggestions and provided a type of care that made a difference. So when I moved to St. Louis, one of the first things that I did was look for a chiropractor. Saw a chiropractor here for a little bit who, when she was taking all of my health history into account, she asked me if I had ever cut out gluten or dairy. And I said no. And she recommended just starting with gluten and cutting that out and seeing what happens. As I continued to see her, I cut out gluten, and that I think it made enough of a difference that I stuck with it for a long time. And then eventually tried cutting out dairy too. So I saw that doctor for a couple of years, and then it became logistically challenging to see her because of my job and where her office was located. And so I had a friend recommend that I start coming to see Dr. Abbe Keen. And so I showed up as a patient in her office and remember thinking, oh, I think she can hold more of the pieces of this. I think she's looking at me more holistically. And I don't know where to go from there.
I think that's a great place to stop. You're doing wonderful. And I just appreciate your honesty. Like, I think our health histories they're hard things to travel. They're hard to let people see, as we've talked about on this podcast already, like being vulnerable and sharing your story, especially when it comes to health stuff, because everybody has input on your health. Like the lady at your church who was like, oh, you could have Lyme disease. Like, yeah, you might. I mean, there's a lot of stuff you might have. And we're all coming out of a place of wanting to help and to fix and to support. It doesn't always come across well. But anyways, I think you did a great job sharing your story. I would love to know what questions Taylor has.
Well, just something to piggyback off what you just said before I ask these questions that I think I have was, like, when people are doing that, when they're talking about, like, have you tried? Like, it really feels like, takes the emphasis off of the relationship and onto now we're your problem to solve. And that's not their intent. I know, but when we only get seen through our struggles, sometimes we feel like we're missed as a whole being or a relationship, or so I think that's a reason why some people hold back from sharing. Like you're not supposed to talk about these things. You're supposed to just figure it out and keep your head down and grind and just keep going. So I just something to observe there. I think, Kiersten, I'm curious, like, when you started seeing the chiropractors or limited your diet or changed your diet, what happened with the anxiety depression part? Did that change, or is that something different? If you feel comfortable answering that, though. Clarify that.
I'm just thinking, because I'm trying to go back and think about the timeline. So when this is just me thinking.
I see the smoke. It's okay.
So in high school, I saw a counselor for a minute. Actually, a couple different counselors for a little bit. And
it's a short session.
One of them saw one counselor. I think I saw him once. And he hang on, I'm going to back up and say, with your comment about when people are giving us suggestions, sometimes that can feel dismissive of who we are as a whole or as the whole person. I think sometimes I experienced that. Sometimes I was really grateful for the suggestions because I was so desperate for like something, like I actually am really miserable. So somebody tell me something to do.
Yeah, absolutely.
And a lot of people had no idea what was going on and didn't have any suggestions to offer. And so when someone did, I was like, okay, like I'll try anything. But in high school, when I kind of, I guess around the same time that I started getting all of these, seeing different doctors, I saw a therapist once who listened to what was going on and looked at me and said, I don't think you're depressed. I think that you just need to get outside and exercise more. And I remember, I don't know what I did, but I didn't go back. I remember looking at him and being like, this is ridiculous. And leaving and not going back.
The harmful stances we can take as practitioners,
Oh
right?
my gosh.
Right. And you're like, if I could move my body without being in pain, I would. So thanks.
And like you're assuming a lot.
Yeah.
You don't even know me.
Yeah. Like we've literally met once. Sometime after, probably a couple of years after that, I went back to my parents and I said, I want to see a counselor again, but I don't want to see this person. So they sent me to a different therapist who was really great. And she actually recommended that I see a nutritionist. I would say the nutritionist was probably the first person who I felt like really was paying attention to more than just the symptoms. And she helped me. She believed what was going on with my body, and she helped me pay attention to my body and use that information to inform the decisions that I was going to make about my care. So that was super helpful. I saw that therapist for a little bit and got to a point where I stopped seeing her. So I guess I got to a point where I didn't feel like I needed to be in counseling anymore. But when I moved to St. Louis, after I'd seen the chiropractor in Memphis weekly, when I moved to St. Louis and found a chiropractor in that same season, I also started, one, pursuing my counseling degree, and two, seeing a therapist here. And the therapist who I saw, her undergrad was in nursing. And I felt like she also helped me piece together emotions that I was feeling with the chronic pain that I was experiencing. And so I actually look back at, and still to this day can say, a lot of my pain, a lot of times when I'm experiencing pain and tightness in my body, it's emotion related for me. And so that has helped me though, because before I remember walking into that therapist's office and I remember telling her, I don't get mad.
Oh, I love it when people say that. That's my favorite.
I don't get mad.
Where does it go then? Because you get offended. Where does it go?
And I don't know what she said, but I remember months after that, something making me really mad and walking in and going, I'm really, like, people have always gotten mad on my behalf. Now I'm really mad.
There it
And
is.
now I think learning to find the connection. I think what I felt for so long was the physical pain. And I could name, hey, I'm feeling really sad. I'm feeling hopeless. I'm feeling anxious. I'm feeling overwhelmed. But I couldn't name a lot of the other emotions or feelings. And so learning how to map that and connect it to my body really helped me understand what was going on mentally.
I love that. I think
That's amazing.
a great spot to turn the spotlight on you, Taylor.
But we're talking about Kiersten's story. This is her story.
I know, but I
brought it back to me.
Okay.
I talked about vitalistic care and mechanistic care. And, why would a chiropractic physician and her husband, the mental health counselor, even be starting a podcast?
Seriously.
Why are we? But so much of what Kiersten just said in that little blurb right there was the mind-body connection.
Absolutely.
And why we want to have this conversation, especially faith-filled and curious conversations, is because a lot of times we are met with a little bit of resistance in church circles and Jesus-loving circles when we say things like mind-body. Definitely gets captured and has gotten captured by non-Christians throughout the world. but it doesn't mean that it's wrong or bad or pagan or worshiping Satan when you talk about the mind body connection. And I would just love for you, Taylor, to explain a little bit. I mean, you're a somatic therapist. What does that mean?
So many things. Well, honestly, like what you just described, Kiersten, of shoving your emotions down because there isn't, as we talked earlier in our podcast journey, there isn't safety or opportunity or even invitation to share what's happening. And we're also not taught. Like our parents many times are just replaying their childhood experience as their parenting journey. Sometimes they're paying attention and they kind of do something different, but they don't teach us. And so, like a lot of times in my office, they are allowed to have one emotion. Usually it's anger or outrage, and they don't understand the coupling of emotions underneath that. So when we bring the body into this, like the somatic part of my counseling is like there's a lot of people like that share my same certification that do a lot of different things. And I share that certification with physical therapists, occupational therapists, all kinds of other practitioners, which is a really cool little window of or sliver of people that kind of come together. But like for me, the way it shows up in my office, like there can be hands-on, there can be touch, but there's most of the time just me paying attention to you as a entire system, right? Helping explain the physiology of like that you actually understand your emotions because you have sensations in your body.
Yeah.
Like it's not a brain thing. Emotions don't come from your brain. They're just understood through your brain after it kind of has learned what these symptoms, these sensations, these things that are happening physiologically are kind of mean in the context. And because our brain's really good at this, but we can also trick our brain to overdo things. We can go a little too far, or we can be a little bit too much. And like, maybe in the space of like, we teach ourselves at a young age to shove emotions down because they're not welcome. But here's the thing, they don't go away. When you have big emotions, like they don't just, time doesn't heal like those things. I was at a conference with Dane Allender a long time ago, and he's like, time only makes things more squishy. It doesn't make them go away. And I'm like, it's a very interesting way to put that, Dan, but it's true because it's still there. It just kind of maybe morphs or changes. It gets shoved into a corner so it changes shape maybe, but it's still there, these emotions, and they're important because that's how you understand yourself in relationship to other people. If it's your family as a young kid, that's how you understand yourself to the people who are representative of God, like your caretakers, right? And so we're not allowed to, many of our families don't know how to teach us to share emotions, don't allow us to share the emotions, because sometimes those sharing of emotions is an indictment of their parenting as if they'd done something wrong. Because we can get caught as parents in the trap of our kids' success is a reflection of us as people. And it's a trap, and it's a big one, but it's also something you get to pay attention to because like you obviously, I'm proud of my kids. I take pride in the fact that what they do, but what they do is them, not me. And so there's just so many things that are like kind of come into this, but like that shoving down. I have seen an uptick of people in my office in the last 5 years specifically who are in their about 35 to 45 who come in and they're like, I'm having panic attacks. And I'm like, okay. And they're like, I've never had anxiety before. And I'm like, oh, okay. I already know where we're going, because they haven't actually allowed themselves to feel, recognize, acknowledge, sit with these feelings before. And now their bucket is full. Mm-hmm. And there's no more room to shove anything down, no more room for it to go anywhere. Mm-hmm. And now it's coming out of the cracks and they can't control it. Sometimes it goes into our bodies and it becomes pain. But like, I don't want to minimize chronic pain for anybody. I don't think it's always connected to emotional things. Yeah. And that's why I think the medical model fails, because it tries to make everything causational from one perspective without accounting for a person's history that can come from many different directions and get to the same place.
Well, in light of what you're saying, Taylor, on a vitalistic scale, we're looking at health on a scale, like a pendulum, right? And on one side of that, you have death. And on the other side of that, you have pure vitality. And obviously, pure vitality, we're not going to really see that this side of heaven. It's just, there's always some sort of limitation. But in the mechanistic pendulum or scale, we're going from vitalism. And as you're losing some of that health, as chiropractors, we like to call it dis-ease instead of disease, but like a dis-ease in your system. You know something's off. You knew something was off, Kiersten, when you were in 8th or 9th grade. Something doesn't feel right, right? And what the medical practitioners who were trying to care for you, and I have no doubt that their heart was for your healing, right? Is they're trying to do all the tests that have been made by man to put you in a diagnosis box. Because once they find the box, then they have their rubric of care. How are they? Okay, well, if you're in this box, you get this medication. If you're in the diabetes box, you get metformin or whatever, right? And so there's like the boxes of diagnoses in a medical model that then determines the flow chart of care that will then commence. What Taylor's kind of touching base with and what vitalistic care is saying is like, we want to honor that story. You are your best barometer for what's going on in your body. Like when someone comes in and tells me that they have issues, like that counselor who said you weren't depressed. Wow, that was a big assumption, right? He's talked to you once. So how does he know? Did he even ask if you went outside and played and walked and ran before he prescribed that, right? So on a vitalistic scale, we're trying to help truly believe, okay, you're experiencing dis-ease. Your blood work might be perfect. You may have no other signs or symptoms other than this. What is your physiology telling us that's off? How do we support that? And before we just wait until it gets worse, right? And we hear those stories all the time of like PSA numbers for a man's prostate are elevated, but not in the dangerous zone yet, right? So medically, their hands are tied. Insurance isn't going to cover anything unless there's a diagnosis code. So vitalistic care is going to say, oh, well, we have a ton of research on herbals that help prostate health. Maybe the guy never drinks water. Who knows? But let's dig into your lifestyle and figure out what could cause these PSA numbers to be elevated. And let's drop them down so that you're not just waiting for this 6-month follow-up appointment and praying and clinging and worrying that you're going to then have prostate cancer, right? It's like, what can we do on the front end? And unfortunately, well, I don't know. I don't know where I was going to go with that statement, but that's just the different paradigms.
Yeah.
My question that I asked you yesterday was, how did you receive these things, right? Like, obviously the chiropractor, you were just like, I'm doing it. I'm so in need of something. Like, I'm going to give it a try. When the second chiropractor was like, okay, give up gluten and dairy, how did you take that? What was your thought process?
With the chiropractor who suggested that I give up gluten and dairy, through a meeting with the nutritionist that I saw in college, I had already started paying attention to what I was eating and like hunger and fullness cues and trying to aim for a balanced diet, trying to get protein and fruits and vegetables in. So it wasn't foreign to me to pay attention to what I was eating. I didn't at that point. That was in 2012. And I had just moved to St. Louis. In Memphis, Memphis is, I don't know, I can't speak to Memphis now, but in my experience in Memphis at that point was that Memphis was a little bit behind where St. Louis was health-wise in my world. And so I had no idea what gluten was. And to go gluten-free, I remember going home for holidays or going back to Memphis to visit and telling people that I wasn't eating gluten, and nobody knew what that was. But I think I just had to do a little bit of research, and I was okay with cutting. I was really okay and ready to try something that might lower inflammation in my body. I didn't try giving up dairy for a little while after that because I really liked cheese. And so that was a little bit harder for me to do. And I remember after that, though, also kind of falling into like I started teaching and what life was busy and it was harder for me to cook my own meals. And so I would buy like gluten-free frozen meal, like just, okay, it has the label gluten-free on it, frozen meals. And that whole time, I remember being able to tell like what's making my body feel more inflamed and what's making it feel less inflamed.
Yeah, that's awesome. And that's amazing that you got to a point where you could sit and pay attention to how your body responded, right? Like that's what Taylor's talking about with emotions and paying attention to what emotions are doing in your body. And so it's the same with food. It's the same with relationships. It's the same with movement. And this is a lot of what we're going to continue to talk about as we break down all these topics, right? I think why I wanted to touch base with your story and talk about mechanistic and vitalistic as like a paradigm thing is just there's a lot of information out there. And our culture is shifting and what's happening. And there is some polarization politically with all of this too, with holistic care, with gluten, dairy, medications. There's so much happening. And I'm hoping and praying that the Lord uses these conversations to allow people to be curious. There is research on all the things in every direction, right? There's so much that we could use. And again, we're coming from a faith-filled, curious place of hoping that everyone realizes we are not against medical doctors, right? Like I'm in a car accident on the way home and, my arm's broken and my brain's falling out. Like, take me to the ER. Do not go get me adjusted. It's not going to work. But in what I heard in your story is like, wouldn't it be cool if when an eighth grader comes to parents with musculoskeletal complaints, we would be able to confidently send them to a musculoskeletal based physician who is aware of all that. And, like your dad cracking your back with hugs. Yeah, that helped for a moment because the neurology of an adjustment to a spinal segment has been proven time and time again to change the neurological workings of your brain and nervous system. And it's so cool, right? But what he was doing was not putting it where it needed to go when it needed to go there. We always say, like, you could teach a monkey to adjust somebody, but it's having the understanding of what needs to be adjusted, when it needs to be adjusted, and how it needs to be adjusted. That is the profession and the schooling and what we go through as essentially nervous system doctors. So all that to say, it makes sense that when your dad cracked your back, there was a little bit of relief. But I look at that and I'm like, oh man, that could have been a segue for you to get to a chiropractor so much earlier. Of like, oh, that could have helped. Or if a muscle relaxer worked and helped you get out of pain, what's a natural form of a muscle relaxer?
And why are my muscles so tight?
Yeah, chiropractic care, right? So
I also want to, I know we're like nearing the end of this episode, but there's so much more. I think 10 years ago, or 20 years ago, I could have listened to an episode like this and been like, as someone who is struggling with chronic pain, thought, okay, what I need to do is cut out gluten and dairy. And like,
yeah,
that's not where I am now. Like I eat some gluten and I eat dairy. And that was just everything that I just shared was a little bit of my journey to more of a vitalistic care method. I'm not saying that as a recommendation, any of those like things that I did as a recommendation to someone, because I don't even, it's important to take their individual stories into account too. And I'm in a different place than I was when I was following those particular suggestions.
Yeah. Absolutely.
There's a certain level of fad to the gluten thing too. It's like this, everybody's going gluten free now, right? And it's like,
well, and there's reasons, and that we can make.
I know. I'm just saying, like, there's it becomes like in the counseling world, we have the same thing. Like, there's an upheaval of only talking about shame. So everybody comes in and is like, I have shame. Like now it's
Yeah.
like, it's like, oh, I'm bipolar, or like right now, actually, the word is narcissist. Narcissist is the key word everywhere. Everybody's a narcissist.
Why?
And it's like, well, I mean, just because you're selfish doesn't mean you're a narcissist. Just because someone acts in their best interest doesn't mean that they're against you or that they're a narcissist. And so like, like there is like we just kind of we paint with wide brushes sometimes, and we don't actually, like, that's why I think it's really important to actually slow down as you do an Abbe, and you hear their stories, you hear their health journeys, and even when I don't make recommendations health wise very often. I do encourage people to, not drink soda, or to drink more water, to get outside, to exercise, like get better sleep, because those are natural remedies for,
And generally
get,
everyone should do.
yeah, generally you should do these if you're not, and do better with them if you're failing or struggling. That's why that counselor really missed with you, because he gave you a good recommendation, to go work out, but he didn't actually know you to actually understand that that's probably what you wanted to do, but you couldn't. So anyway, like just that we paint with wide brushes, and we miss people sometimes when we don't allow ourselves to hear their journeys. And I think that's why it's like the relationship has to be a part of it, and not just a 15-minute pop in for a psychiatric diagnostic, or a check in with a doc, and you're just getting prescribed the next medication on the list. So.
Yeah. And it changes, right? I like that you said that, Kiersten, like this is not a recommendation for everybody. It changes based on your life, like where you are, what your story is, right? How you're taking care of any pain that pops up now is different than you did 10 years ago, because we've peeled the layers of the onion back. And that's something I say with patients a lot, is like your healing journey is a journey. It's called your health journey for a reason. Health is not a destination. And we defined it in episode 0 of like health is being able to appropriately adapt to your day-to-day stressors. And so when we are maladapting to day-to-day stressors is when we want to bring that curiosity of, why is my body responding this way? Why is my mind responding this way? And what can I do? And that's where knowing your body is so important, and why learning how we work, I think, is biblical. I really think it should be something that we are teaching our kids and our churches of, like, this is the body you've been given. This is the temple you are blessed to steward. But in order to steward something, you have to know how it works. And so hopefully, prayerfully, that's what the next podcast episodes will start to unravel as we continue to talk about how we do it in community, how we do it mentally, emotionally, physically, interrelationally, and in Christ together. So, do you guys have anything else to add since I opened it? Should I close it?
Yeah, do it.
Okay. Well, you're listening to the New Dominion podcast. We are so glad that you chose to listen to today's episode. If you liked it, enjoyed it, or just feel like you should share it with someone, please do. Click that share button, send it to your best friend or your mom, but also like it so that others can find it and hopefully grow in hope as well. So we'll talk to you soon.